Thank you, David. Our speaker today is Brian Colby, the Vice President of Public Policy for the Missouri Budget Project. The Missouri Budget Project wants to improve the quality of life for all Missourians by informing public policy decisions through objective research and analysis of state budgets, health, tax, and economic issues. Prior to joining the Missouri Budget Project in 2017, Brian served 7 years as Policy Director of the Missouri Health Advocacy Alliance, where he worked on health policy at both the state and national levels, advocating for the consumer and the underserved. Prior to that, he was a coordinator for health policy for the Missouri Association for Social Welfare. Welcome, Brian.
Thank you very much, Kathy. It's nice to see everybody. As I said, my name is Brian Colby, and happy to talk to you today about kind of what's going on with regard to the budget, what happened last year, what we expect for next year. So it's going to be fairly wonky, but I hear this is a very good group and you're very tied in, so I'm not too worried about that. You may be so knowledgeable you catch me with a mistake. That's what I worry about, but we'll deal with that if it comes around. I have a PowerPoint that I was going to do for the first part, and I don't know if I can share my screen now. I think I can.
Yeah, you should be all set. Go ahead.
Excellent.
There it is.
Let me get into slideshow. It does this to me every time. It just has a drop-down menu, so it doesn't like to show my first slide for a minute here. It will go away in a second. Just a little bit about me. I work on state policy. I'm a lobbyist. I registered as a lobbyist with the state, and so I'm in Jeff City with a number of my colleagues. Here we go. This is how I can do this. Okay. During the legislative session, but I live in Kansas City during the rest of the year. We work on primarily state issues, but work very closely with national partners, some of which you may be familiar with, the Center on Budget and Policy Priorities. We just got back from DC meeting with them, and Families USA, Georgetown Center for Insurance Reform, the Georgetown Center for Children and Families, and numerous other national experts that help us kind of gather together this info. On our staff, we have Amy Boone, who's been the longtime executive director of the Budget Project. We also have Tom Kruckmeyer, who's a name that may sound familiar. Tom was a 30-year veteran. He was the state economist for 30 years. We have researchers and communication people as well that help us put together our reports and do the work that we do during the year. And so on this slide sheet, I'm going to talk a little bit about Medicaid expansion and COVID and public health emergency and some of the bills in the special session for the tax cut. I'll move relatively quickly through it just because I think most of you know a lot of the information. If you do have a question, just feel free and interrupt me. I do during legislative sessions at 3 o'clock on Thursday, a conference call with advocates and lobbyists from across the state, talking about the week that just finished up and what we expect for the next year. If you're really a glutton for punishment, you're welcome to join those calls. They're open to the public. Just send me your information or send it to Kathy and she can forward it on to me. That's a little more in-depth discussions. The budget project is funded by a large number of foundations. We're primarily foundation funded. Started almost 20 years ago now with the help from the Missouri Foundation for Health, and then the Kansas City Health Foundation, now Health Forward, and all of the health foundations, and you can see our other partners there, Rockefeller and Francis Family and Deaconess and quite a few others. And we also have individual donors, but the main dollars come from foundations, all of which are nonpartisan, and we're a nonpartisan group, oftentimes called left-leaning, but you know, when you talk about numbers in the budget, it's hard to make them lean one way or the other. So if left-leaning means we're telling the truth, that's okay. I'll take that. When we talk about budgets, I always like to start with this slide. These numbers are a couple years old, but they give you an idea of what we're talking about. The budget is often called a list of priorities, a moral document. And it's not because we're just dealing with numbers and dollars, it's because it involves so many people. And here you can see just how many Missourians are touched by different areas of our budget. And the numbers are really, really large. You know, 900,000 kids in K through 12, over 150,000 in higher ed, almost 20,000 foster kids, which we like to call our kids in Missouri. We take care of about 36,000 kids with subsidized childcare, mental health services, adoption services, and then the healthcare services that you know as Medicaid or CHIP or Mo Health Net. We're up over 1 million people now in the state of Missouri that receive healthcare from the state and from Medicaid in our partnership with the federal government. That Missouri has been able to establish for a long time a partnership that I'll talk a little bit about that's very advantageous to the Missouri budget. It's really something that I think Missouri should be proud of. Some people outside of Missouri raise eyebrows and how creative we are with our accounting, but we'll talk about that in a little bit. But large numbers of folks being helped by the budget every year. And as you know, we have to come together at the state legislature. The one thing that they have to do every year is pass a budget. It's required by the Constitution, and it's the number one thing that the legislature does. And I'll talk a little bit about that process at the end of this if people are still interested in hearing from me. As you know, we had a ballot initiative, yes, on two, healthcare for Missouri, that won. Thank you all for everybody on this call that helped. It was a great achievement. 10 years in the making. And I've been working on it for all 10 years. I was in front of the Supreme Court when the Supreme Court ruling came down. I was there for a National Association of Insurance Commissioners meeting and walked over to hear the verdict, and was excited that the Affordable Care Act was upheld. And then, you know, the gut punch of having Medicaid expansion being left to the states to decide. And I knew immediately what that meant in Missouri. It meant that low income workers, low wage workers in the state of Missouri were going to bear the brunt of negative feelings about the Affordable Care Act and Obamacare. And indeed, it took 10 years to get it done, but we did. And we won in a pretty good margin, 53-47. Then the legislature came back and said they're not going to fund it. And we had to go to court, and we won. And I happened to be in the Supreme Court for the rulings, for the appellate court and the Supreme Court rulings, and then was with some friends when we got the verdict handed down. And so we finally have Medicaid expansion in the state of Missouri. It is fully funded. This is what it looks like in the line item in the budget. House Bill 11 is the Mo Health Net budget. So section 11 refers to the House bill, and then 0.825 is the Mo Health Net division with the expansion of Medicaid in there. And that means that we're going to have about $2.5 billion come back to the state to help support our hospitals, our community clinics, our mental health providers. We're going to deliver about half of the babies in the state of Missouri, about half of the nursing home beds, but with Medicaid expansion and those childless adults, the working poor, or the low wage workers, I like to call them, had no access to health insurance, and now we do, and is primarily funded by federal dollars. You will see that there is a small component of general revenue. That's the one that's highlighted at the top at about 230 million. That's a little bit of a misnomer. We have to have a contribution from the state, but the savings that come from having so much more money coming in by having services that we have provided with 100% state dollars now will be provided with federal dollars, either 90-10 match or a 65-35 match, which means that the federal government puts in 65 or 90% and we put in the remainder. Well, the way that works out in Medicaid expansion is we actually come out ahead. And those savings fall to the bottom line. And I'll talk a little bit about that, but we think that there won't be a real GR component for Medicaid, at least for 10 years and maybe never. And I can talk about that later, but it really is a great thing for responding to the health needs of our state. So this is a little bit wonky, but we'll walk through it, and I think you get it. Medicaid is funded in large part with federal funds. We hear a lot in the state legislature about how expensive it is and how terrible it is, with some of the majority members rather in the legislature saying that it eats up lots and lots of dollars that should be going other places. That's not the truth. It is primarily funded by the federal government, more so than even other states. In this graph, you can see that dark blue, those are federal funds that come in about 4.7 billion in the year 2020. That will be much higher in the next fiscal year because of Medicaid expansion. And then the federal reimbursement allowance, that's our hospital or provider tax. The one in gray is the provider tax, but those are federal dollars too. The provider tax is kind of separate in the budget. And then that red line is 500 million in other provider tax. So pharmacy, nursing home, ambulance tax, and some other very small contributions go to pay even more of the bill for Medicaid. And that red line is federal funding as well. And so you could see the dark gray general revenue. Those are the state funds that come in and fund what is about a $10 billion budget. And you can see the vast majority of the funding comes from the federal government. And so we do see increases in Medicaid costs year in and year out as healthcare inflation occurs, but it's very small in relationship to the entire Medicaid budget. Because our general revenue is relatively small component. When there's inflation in a cost sharing program like Medicaid between the federal government and the state government, it goes and is applied to equal parts of the state and the federal government because it's a set percentage. And so as costs rise, the federal funds rise with the increase in cost. If costs fall, the federal participation in real dollar amounts will fall, but that percentage stays about the same. And that percentage is somewhere in the area of about 76 to 78% federal funding, with the remainder coming from a little bit of general revenue and a little bit of some other state funding that I won't talk about, cigarette tax and that type of thing. But I just like to make sure that we're clear that this is really a big federal program that comes into the state and helps people. These are just the eligibility level now for different populations, and that expansion populations on the top. A family of 3 can have an income of over $30,000 and qualify. for coverage. That's new, obviously. Before, you would have to have a child at home and couldn't make more than $3,600 for a family of three. Very, very, very poor. Now, working adults, low-wage workers, people that have had their children move out of the house, which is a large number. People don't really think of it that way, but people without children at home can qualify for health coverage now. And of course, the aged and disabled, the blind remain the same. We have been very generous with kids on Medicaid and CHIP. CHIP can go all the way up to an income of almost $70,000, but with the caveat, that's a pretty large premium that the family pays. So the state's portion of that CHIP kid minus the premium is extremely small. That's why we are so generous. We go up to 300% of the federal poverty level. As you know, and you've been around long enough, children are looked at as a little bit different than adults. They should not be, in the words of some, blamed for the situation their parents are in. And so we've been historically more generous with kids, the same with pregnant women. And then we passed a few years back the Show Me Healthy Babies, which is essentially CHIP for the unborn. This covers women who are pregnant in the state of Missouri, their child, regardless if their own immigration statuses are citizens. And so every unborn child in the state of Missouri under 300% of federal poverty level can qualify for some type of coverage that can help that pregnant mom get through her pregnancy and delivery. And that's turned out to be a great program. And so that last line is just a single adult household. You know, before, these people never had any chances whatsoever. And they're young people coming out of school, they're older folks working either part-time or at a low wage work job. And now they get covered, and it's extremely important. How many folks are we talking about? A large number, 1.3 million adults and kids. And 265,000 of those are expansion folks, newly eligible. They used to call it the adult expansion group, AEG, and now they're calling it even wonkier name called the MAGI, modified adjusted gross income. Nothing you all should have to worry about, but it's the way they qualify folks. But we had a very slow start, as you know. Even if when we went through the fight to get it funding, the department was very slow in enrolling people. You probably read some of those stories that we had large backups and pending cases and people not being able to get on. At one point in time, we had waits over 110 days. The federal government will not allow us to have a wait period longer than 45 days. So we were twice what is allowed by the federal government. So a group of advocates and organizations, hospitals, associations, Budget Project, other advocacy groups came together with the foundations, addressed the federal government and our state departments with our Family Support Division, which enrolls Medicaid folks. And we put together a mitigation plan. The CMS offered, it was accepted. And those, we went from somewhere in the area of 60, 70,000 people pending to 5,000 now. And the wait times have come way down, somewhere in the area of about a week or so. So it's been very successful, and that's been a good thing. Because so many people do rely on it. As I mentioned before, about half of all the births in the state of Missouri, about half the nursing home beds are Medicaid, and about half the kids and a growing number of adults. The normal Medicaid federal participation is a split between federal and state dollars. The normal Medicaid program, 65% federal and 35% state. But with our provider tax that we have, our hospital tax, we reduce that GR number by half. And so that's a huge development. And what does that mean? As you may remember, 2 years ago after session, the legislature did not want to reauthorize the provider tax. They went into special session to do it. The provider tax is about $1.2 billion. It brings down $1.8 billion in federal funds, so a total of about $3 billion. A lot of elected officials may have thought that that would have come out of the hospitals or the Medicaid program. Part of my job was to explain that that's not the case. If we're going to have a Medicaid program, we're going to have to pay the hospitals. We're going to have to pay for a Medicaid program. We're just going to have to come up with $1.2 billion in state funds, meaning we're going to have to cut K through 12. We're going to have to cut public safety. We're going to have to cut something else to not do a provider tax. Cooler heads prevailed. It was passed, and we still have that here in the state of Missouri. And so a lot of general revenue gets to go to other places other than Medicaid. Under the new Medicaid expansion, as you well know, it's 90% federal dollars, 10% state dollars. And you can see with our provider tax, the state share is about 130 million. They called it 230 million last budget. It's really just a mandatory kind of contribution by the state. It's really taken up by the savings. There is no cost to expanding Medicaid. So this is where we get wonky, and hopefully people can see this okay. But if not, I'll just describe it briefly. We won't spend too much time on it, but we've been going through the pandemic. So we're under a public health emergency, what they call the PHE. That has come with all kinds of rules, all kinds of money. We'll talk a little bit about that later. But the big thing with regard to Medicaid is that we cannot kick anybody off the program during the public health emergency unless they pass away or move out of the state. So our rolls are growing a little bit because normally there'd be people revolving off. But because of Medicaid expansion, the numbers are growing, and because of the emergency, more people qualified. So we have a little bit larger number now, and the feds say we can't cut anybody off. And to go along with that, they said, we'll pay for the new populations and we'll give you a bump, is what they call it, an extra 6.2% of your Medicaid costs will be paid for by the federal government. It's roughly in the area of about $375 to $400 million per quarter. And it goes by quarter as long as we're in the public health emergency. And so that's a tremendous amount of money that we've been receiving since March of 2020. The state budget officials and budget committees decided not to spend that money on Medicaid because of we didn't know how long it was last. We had already budgeted for Medicaid and not used it, so they set it aside in a fund. We can talk about that. And those monies are just building up. It's not really federal funds. It's really general revenue funds that we're not spending on Medicaid because of the federal funds. And those are just piling up and are going to be put in a fund and used to pay for Medicaid expansion if it ever actually cost us anything. On top of that, we expanded Medicaid in the first year after the passage of the CARES Act and the Affordable and ARPA, and that allowed us an extra 5% of our cost of our Medicaid program for 2 years as an incentive to expand Medicaid, and we qualified for that. We came right underneath the wire, and that's about $520 million a year for 2 years. And we've set that aside. And so the state budget is sitting on a Medicaid expansion fund of 520 that will be about $100 or $1 billion after the end of 2 years. And then this other enhanced FMAP that's upwards of about $1 billion. So we've got about $2 billion in funds to fund our Medicaid program going forward. It doesn't have to be spent on Medicaid. It's general revenue dollars, could be spent on anything. But our chairman of both the Budget Committee and the Appropriations Committee decided they wanted to set it aside and have it fund any Medicaid over cost estimates that we haven't seen yet. So we're flush with cash in the Medicaid budget. We have reserves if anything has a cost overrun in our Medicaid program. And so we're in pretty good shape there. Does anybody have any questions about that? I know it's an awful lot, kind of wonky, but we often hear how terrible Medicaid expansion is for the state budget. It's just clearly not the case.
I have a question about those funds that have been set aside. Do you foresee the legislature allowing those to sit there, or will there be pressure to spend it on something else?
There will always be pressure to spend it on something else. And as of right now, there's a broad consensus to set it aside, but we have term limits and we have changes in our chairman or chairs of the committee, chairman or chairwoman, I apologize. So we may have leadership that changes and they have a different idea about how they want to spend it. And they can change those funds by simply passing legislation or enacting a new fund and transferring them in a budget bill. So yes, they can be moved. I don't necessarily anticipate them being moved because we have other funds that are piling up because of increased revenues in the last few years. But they are general revenue funds. There's no mandatory need to spend it on Medicaid.
I just had a question.
Go ahead.
It's more of a comment rather than a question.
Sure.
But I was shocked by half of the births and half of the nursing beds are paid by Medicaid. And that doesn't Medicare does do some of the beds for like 30 days after you've been in the hospital or something.
That's right. It's limited. And so the only sustaining financing for Medicaid for folks in nursing homes that have run out of their savings is Medicaid, really, for long term. And that Medicaid participation by the federal government and the state. As you may know, many people enter into nursing home or skilled nursing facilities after they leave their own home, and it's extremely expensive, and they go through savings very, very quickly. And they may not start by being on Medicaid, but if they outlive their savings, that's where we end up.
Then I have one other question about the recertification process for Medicaid. And it's my understanding that that's been kind of suspended during the public health emergency, but will be required again afterwards. And given Missouri's track record with that, do you foresee them dumping a lot of people from?
Yeah, we are working with the Department of Social Services, Family Support Division, and others, and trying to make that change as seamless as possible. We hope that a large number of folks don't fall off quickly. The department has agreed to spread that redetermination, is what they're calling it, over a period of 12 months. So whatever month that you had signed up in previously to the public health emergency will be when you would need to be redetermined. So that spreads it out over a 12-month period. That will be helpful. There are a number of changes that allows in the mitigation plan that allows the state to do things in a streamlined way. They can look at folks that are receiving food stamps or SNAP benefits. If those guidelines match Medicaid guidelines, they can be reauthorized. Kids can have other like SNAP kids can use that for redetermination. If families, and this is there for folks that may have no kids on Medicaid or CHIP, if they update their address and their income now, that will qualify as information they can use for redetermination. And the folks that go through the federal exchange, which we call the marketplace, during open enrollment, which is going on now, a number of those folks get their income and their citizenship and a couple of other things verified at the federal level. The state used to ignore that and went and checked the same information over again for all those folks. We don't do that anymore. They took our suggestion and said, we're going to go along with the Affordable Care Act that allows the state just to use the federal determination to do that. All of those things are going to bring that log jam down. And that's where we really feared that we would lose a lot of people that were eligible, but not able to get redetermined or enrolled. And that, if we can keep that log jam manageable, I think we'll do a lot better than if we hadn't done the work ahead of time.
That sounds really good. I'm very glad to hear that they're using those mechanisms.
Yeah, and I've got to hand it to all the folks that came together. Got to hand it to Kim Evans, who's the director of Family Support Division and the Parsons administration and Parsons appointees and DSS, and they've worked with us. They've worked with CMS. And I want to thank CMS because they don't normally do this, but they said, Missouri, you guys are a special case and you're way out of line and we need to come back in, and we were able to do it all in a big effort. So hopefully that remains to be the case.
A small request. I hope you can suspend the frequent reference to wonkiness. This is not wonky. It is real and a critical component of any realistic and serious assessment of what we actually do. Now, I admit, I'm a former budget analyst as a McNamara quiz kid at a high level in the Department of Defense. I'm not a wonk.
Well, I think if anything qualifies you as a wonk is being in the McNamara Department of Defense, but that's a whole other discussion. Excellent, Herb. Thank you. I appreciate that. And I have a feeling I'm talking to some high level folks. So if I get redundant, just tell me to hurry up. But it's just been a real strange to do budgeting because we've had this COVID crisis, then we had the suspension of a lot of the rules with Medicaid and this extra funding, but we also had these strange, remember, we didn't have to file taxes in 1 year, moved it all in the other year. Well, what that did was dump all the revenues in 1 year. We had to go plane it all out, try to figure out what it was over a 2 or 3 or 4 year period. And so it's just been a strange year. And all of these funds that are piling up, it's really odd that we've created these funds in some way, but they're out there, they exist. They're about $2 billion. And those are just the kind of set aside Medicaid and COVID relief funds for Medicaid. We also received COVID relief funds for COVID state aid, which was in the billions of dollars, couple $1 billion. We still have about 1.2 billion on hand, but that's been appropriated. And you'll like this, Herb, is that, it's a federal thing. We deal in our fiscal year, which is July to July. Feds are operating on the calendar year, but then they do multiple years, right? So all this COVID funding, had to be allocated or obligated by 2024 and spent by 2026 in a state budget that goes on a 1 year fiscal year budget. So we're operating kind of in a different time frame, and so it piles up money that may or may not be appropriated. So the 1.2 billion in our fund balance for COVID aid has been appropriated, but our GR budget has about 4.8 billion of it, and we've been having great collections, and I'll talk about that in a minute. But so about half of that may be in what you could maybe call extra funding, or what they may say is a surplus. But it's a little bit hard to see because they've divided these things up and it's all over the place. But right now the state has plenty of money, but the big caveat is that this won't last forever. It's how they deal with these funds and how they eventually appropriate the Medicaid expansion, the PHE funds, and those type of things will affect how we go forward. And then we have the risk, as always with this legislature of thinking we're flush with money, wanting to do tax cuts. And so at the end, we'll talk about that. Did anybody else have? I saw maybe one other person had a hand up, but if
I had a question, and that is, I'm trying to remember, the Missouri Budget Project has been around 20 years at least. Is that correct? Closer
yeah,
to
we're coming up on
25?
a 20-year anniversary. Yeah.
And I'm trying to remember who some of the original people were. They were pretty impressive people that got it started.
Well, Amy Boone has been the one who started it. She's the real driving force and very impressive. And then Tom Kruckmeyer, who came over, the economist for 30 years for the state. And then a number of staffers in between.
I was thinking early on, there was someone that had been actually head of social services that was involved too, but I can't think of his name.
There might have been, and I apologize. I've been back in the state since 2008, really. So, and then working on health policy and federal policy. So I may be missing somebody there, but unfortunately you're stuck with me. And I'll muddle through. Yeah, but I just want to point out how much COVID relief we had. It was just extraordinary amounts of money, absolutely extraordinary amount of money that flooded into the state. Economic stimulus payments that you all aware of, the $1,500 payments were totaled to be over $5 billion. Pandemic unemployment in the state of Missouri, another $5 billion. A large amount of money for a child tax credit. And then the Paycheck Protection Plan, the PPP, totaled over $12 billion. So some of you may be familiar with former Fed Chairman Bernanke when he talked about throwing money out of the helicopters. This crisis, we threw money out of the helicopter. It was bazooka effect, and they just flooded the zone with money. Helped a lot of people, but it also helped our budget. That will be receding, and the effects of that will change. I just wanted to point that out, and that it makes it a very different year. And as you can see here, these are the different budget years. The top line is FY23. The large amount of federal funding that primarily was from COVID funding, that will recede back to kind of a normal level. We'll look a little bit more like, say, FY 2022, FY 2021. So what to watch? We talked a little bit about this already. That enrollment process, redetermination for all Medicaid recipients, big deal. End of the public health emergency, that will be a big deal. We will no longer get that extra $400 million a quarter for Medicaid programs, so that will be a change. We may see some issues on some homeless and housing. There's a bill that passed at the very end of the year. Not too many people were paying attention. It kind of squeaked by. So that will probably be litigated this year. We think that there's going to be a movement. There was a little bit in the special session to eliminate the corporate tax cut. We're already have a very small corporate tax, somewhere around 3% or so. We're the third lowest in the country. We think that there may be a move to eliminate that. That's a bad idea, and I can go into why. As you can imagine, we have sales tax, corporate tax, general revenues tax, income tax, and it's good to have several sources of revenue. Getting rid of one is not a good idea when you have economies that go up and down and revenues that follow the economy. The budget's always a concern. This is a little bit about the backup that we had seen in enrollment in Medicaid. This is previous to the implementation of the mitigation plan. These numbers have come down dramatically, but you could see just how out of whack we were with 70,000 pending cases. It got up to be over 100 days waiting to get enrolled. No way to run the program. All of those numbers have come way down since this slide was made. And I appreciate McBride at WashU, who's a healthcare economist that works with us on this project, and he's been tracking this on a daily basis. And again, a little bit more about the mitigation plan. We talked a little bit about it. Some of the very good things that are coming about because of that. We just heard on a meeting that the state will request CMS to go ahead and continue all the good stuff that's going on. So we think that's a good sign, and we're hopeful that we can get through the ending of the public health emergency with some help. So we did go through a special session. There was a tax cut proposed. We proposed tax cuts that could apply to everybody, but in the special session, the tax cut that did come out left out about a third of Missourians, those who didn't have a tax liability, those many retirees. It was heavily weighted to the wealthiest, and the more we cut general revenue, the less resources we have for services going forward. We're in a good budget situation, but as you all know, we've been in very tight budgets for the last 10, 20 years. So we will return to tight budgets again. And if you cut back on revenue, it's a problem. We work with the Institute of Taxation and Economic Policy, ITEP, and they're able to do analysis like the one you're looking at. And this just shows income levels in different, really we do 5 quintiles of income, but we throw on a couple on the top to show how heavily weighted the tax cuts were for folks at the very highest levels of income. You can see a low-wage worker got an average tax cut if you make under $22,000 of about $3. You know, if you make over 1.5 million, you had about $10,000 cut. So very heavily weighted to wealthier Americans. They did get through a compromise bill in the special session. Not as bad as it could have been, but it still is a reduction of revenue going forward. And as we all know, there's inflation that always exists. It's been heavy this year, which causes prices to rise for the state, and we got to keep up revenues to meet that need. This is just another example of what that tax cut looked like, and how heavily weighted it is to the top. As you well know, our tax system has not been updated for, I think, since the 30s. So our graduated income tax levels top out at about $9,000 of income. So it is a graduated income tax, but it's still very, very low. And so any changes to really kind of impact higher level of income folks, but they're paying more in taxes, and you would expect that. We advocate for things like an earned income tax credit that we're able to get at a state level a couple years ago that helps low wage workers and workers with kids. We're hoping that maybe we can get a state child tax credit that would also help young families and low wage workers. And that's essentially a tax cut from the bottom up, what we like to call it. It's one of the things that we use when they say, well, we want to cut the top rate of individual income tax. We come back and say, why don't we cut from the bottom up, and kind of spread the love around. And so we hope to improve on an earned income tax at a state level over the next few years, but we have one in place, which has been a 20-year fight, so that's good. And that's really kind of where I end. I'll go back to my information, but I did want to just talk about revenue. I don't know if you folks can see this because the people's faces, but you can move that bar. We have had revenues that are coming in at a very high level. Year to date, fiscal year 23, we're running at about 16% higher in net general revenue collection than we had the previous year. This is very good. Last year, we came in at about $1.2 billion higher than what was estimated for fiscal year 2022, what they call the CRE, or the consensus revenue estimate. And it was about $1.2 billion higher than the FY21 actual collections. And so revenues have been extremely strong, primarily incomes and sales taxes, a lot of pent up demand. Corporate taxes we're collecting a little bit more on because of some changes that went on a couple years ago. Could be better, but that's another subject. But we are having strong revenues, very good. We'll have an extra $1 billion or so in revenue than we probably estimated for. Of course, we're only halfway through the fiscal year, but this will not last. You may have seen a quote by Jim Moody, former budget director. He believes that our growth rate is going to come back down to about 1.5% to 3%, back down kind of to earth after all this federal spending starts to move out of our economy. And if we do move into a recession, well, things are going to be a lot worse, of course, because of that. So I'll stop there and see if anybody has a question, and then we can talk. I don't know how much time I have, not a lot. What we may see in the next coming year, most of which I think you'll know a lot about, but I'll stop for questions or comments.
Brian, I've got a question, and we will share this recorded meeting so people can look online, but are there, sometimes it's easier to spend a little time on different slides on our own. Is your PowerPoint available? Could you pass it or some of the slides from it on that we could at least put out somewhere, share with people?
Absolutely. I think that we sent it to Kathy and another gentleman. I apologize, I don't have his name in front of me, but I can send it to whoever would like it. That's my email address. We have other papers that we put out that kind of describe different things. You can find them on our website or request them from me. But happy to share this PowerPoint with the group.
Thank you.
Go ahead, Sue or Herb.
One of the long-standing issues in Missouri is that the state legislature in particular seems to be quite resistant to serious analysis of the budget expressed in numbers such as this, and especially if there is an attempt to present it on a multi-year basis. Why is it so pronounced here even more than it is in some other states or the federal government?
Well, we have a constitutional requirement to balance the budget that brings clarity every year to the process. Now, there's always a fudge factor in that that's assumed, and sometimes it's actually created. There was a state senator who was the appropriations chair that liked to take departmental estimates, lower them, and then come back and have to have a supplemental budget bill the following year. And then he would decry the budget process and the state budget's out of control and Medicaid's out of control. Yeah. But that was because he just lowered it. I'm not going to mention his name. You may be familiar with him. But that was kind of a little bit of an accounting trick. But mainly it's the requirement that we balance the budget. One of the things that Missouri is very proud of is our credit rating. We've maintained very high levels of credit ratings. And so, you know, all budget processes in different states are a little bit different. It's very, very hard to to measure states against themselves because they call things different. You know, we have the hospital tax. We call it a federal reimbursement allowance. You can look it up. You won't find it anywhere else in the country. We made it up. It was anything to say, not have to say, you know, Medicaid or healthcare or hospital or whatever. But that FRA is specific to Missouri. Other, you know, states use different budgeting techniques and names. And so it's hard to go looking at 101. We're going to put out a report called Where Does Missouri Stack Up, looking at the states around us and tax collections and how much we get from each different tax and where we spend it. But that's the problem. You know, there's an old joke about a Medicaid program. Once you've seen a state's Medicaid program, you've seen one state's Medicaid program. They're all different. And that's the byproduct of federalism. And so that makes it different. Maybe, hopefully, Herb, that's somewhat helpful to your question. If not, feel free to ask again or explain what I got wrong.
Brian, just one quick thing. It was Jim Moody's name that I was trying to think of.
Yeah. And I work with Jim, and he's a nice guy, and we get a chance to work. He's going to kind of pull back a little bit and won't be taking on so many clients. But I hope that he remains in the mix, because he's been a good statesman. And go ahead, Pam. I guess the question.
You said that your meetings are on Thursdays. What time? And then on Zoom, I assume.
Yeah, we do a Zoom call. They're at 3:00 on Thursdays. I think that's what we'll do again this year. And any of you are welcome if you'd like to just be added to the Missouri Budget Project list or the Missouri Health Partners. That's what we call the calls on Thursday.
What are they called again?
Missouri Health Partners, or sometime MHP. It's kind of a name that was created several years ago to work on Medicaid expansion, but people found the calls to be helpful, and so we'll get anywhere between 50 to 120 different advocates, lobbyists, or individuals that are just interested.
Okay. I'll put it in our announcement so it can go out to everybody then.
Sure, that'd be great. And if anybody wants to sign up, you can send me an email, and I can get you on the list as well.
Okay.
Any other questions that I can't see? Feel free to, go ahead, Herb.
I just want to go on record, and I hope you will share this with others. Many of us are deeply appreciative of what your organization does and has done over the last 2 decades. Please thank all the people you're working with.
Thank you, I will. Herb, were you a professor by any chance?
Yes.
I am a has-been professor.
You oversaw the fleet in the Tonkin Gulf, if I remember correctly.
Well, not exactly. You took a course from me, possibly.
I did. It was a little while ago, but I remember you.
Well, that is information that came to me because I was dealing with numbers and what really happened there and didn't happen. I'm not going to repeat it in this context.
Well,
but you got the real poop.
I remember that to this day, and I won't say how long ago it was, but it was a while ago.
Well, thank you very much. You came out of it uncrippled, and I always had high respect for those who could survive my presence in that way.
I did, and it was an impressive class, and I've always
a bunch of good folks.
So thank you.
A bunch of you good folks went to budget and planning, sometimes ran it, otherwise became involved in the serious analysis of public policy, and I thank you.
Well, it's all your fault. So any mistakes I made, blame the professor.
Pam,
You had something you wanted to say. I apologize.
see Pam Springsteel raised her hand.
Yeah, I can remember when someone from the Missouri Budget Project talked to probably the League of Women Voters years ago. And when your group put forward how much it would cost to cut certain taxes, you were not listened to. Do the people in the legislature, do you have a better relationship with them so they know that you know what you're talking about?
Well, yeah, we try to, we have had it said before that you may not agree with our ideas, but you got a tough time disagreeing with our numbers.
Right.
That's, I like to hear that type of praise. And I will say that we have had very good working relationships in the last several years with the Speaker's office and our budget chairs, especially in the Senate recently. The new budget chair in the Senate will be Lincoln Huff. He's a little bit more moderate. We look forward to working with Senator Huff. And on some of the tax bills we've been able to weigh in. We had a tax cut bill about 4 years ago, and we were able to work with leadership and pass the bill, and it actually brought in more revenue. So don't tell anybody, but it was classified as a tax cut. But it's difficult, and too often we rely on the minority party to have to fight against revenue reductions one way or another, and that's unfortunate. Hey, Nancy, I see you there now. So it puts them in a terrible position, puts the party in a terrible position to always kind of be the Grinch or be the bearer of bad news. But that's kind of some of our role. As a percentage of total Missouri personal income, it's a little bit like GDP, but it's actually the aggregate of Missouri personal income. We're spending quite a bit less on state taxes than we had back in the 90s, about in the tune of billions of dollars less. So we are a low tax state, regardless of what you'll hear in the legislature about having the biggest budgets in history. In real terms, the budgets are smaller than they used to be in the 90s. And when compared to the amount of money people earn in the state of Missouri, our budget is shrunk considerably. And so that's the number I like to point out. I don't know if they like hearing it, but it's what we repeat.
I can remember, for some reason, I looked at the big budget book and I was absolutely shocked. At that time, I think the corporate tax was 5%. And I thought, this is not fair that common people have to pay so much more than corporations.
Yeah, I agree with you 100%. That's something hopefully maybe we can change. We'll have to hold off any cut to it, but it doesn't. We changed our law now. Now we really just use what they call single factor to find apportionment to find out how much a corporation taxes. So if we were to get rid of the corporate tax, it would really help corporations that don't live in Missouri. The Missouri corporate tax can be deducted against the federal tax. So even Missouri companies that pay federal tax or state tax get to write it off. If they didn't, they just simply pay it to the federal government. It doesn't make any sense. And maybe we create some jobs, but a lot of corporations from outside of Missouri sell into Missouri without anybody here. But they use our roads, they use our fire protection, police protection. They have a healthy workforce and educated workforce, and we think that they should be part of paying for that. And so it really makes no sense whatsoever. And we have some ideas about how to even make it better, but that's maybe another conversation.
All right. Ryan, I see our time is up. I appreciate so much you can be in here with us and going over this material for us. And I recorded your stuff. I will contact you just for my own sake to try to get a copy of the PowerPoint. I've just briefly glanced at your website. It looks like some of the same things are out there, but then we would bear follow up. Oh, I really like this one. How could I print it? Those kind of things. anyway, I appreciate your time. Thank you very much for coming and being here with us today. So we'll give him a big hand again. And this is our, again, as we said at the beginning, this is
Thank
our
you for what you're
final
doing.
meeting. I see we've had some new people come out. I don't know when they arrive, but just as a reminder, we record our meetings and it should be out on our website within a few hours. And so if you want to look at it later on this evening or tomorrow, you can catch up if you missed anything.
Might be a little later today, David, because I have an appointment at 2, so it might be this evening before that shows up.
There you go. Yeah, he's usually really quick about getting it out there. So I always try to tell people, maybe Friday evening, but okay, good job. Thank you, Dave, for that. And again, this is my final meeting for the year to be presiding. So next time, 3 weeks from now, Sarah Catlin will be serving as new incoming president of Muleskinners. So I want to congratulate her on her election last week. So
I'm sure I speak for everyone, David, when I thank you for all that you and Carl do for the group.
Absolutely. You've been a great president for us, David. Thank you.
thank you. It's been a pleasure.
And David, doing